Thank you for being here this afternoon or this morning for a very important issue for the Mikisew Cree First Nation. I'd like to thank my council for being here, as well as a couple of my technical team, Lori Brebant and Rachel Graham, and as well the Grand Chief. This is the second time in less than 5 months we have left home and traveled 4,000 kilometers to stand here in front of you and to tell you how industry in Alberta is poisoning our water and slowly killing off our community. Over the past 2 years, I have met with countless MPs and Alberta MLAs. We sat down with Prime Minister Carney in December, yet no one is listening to us. No one is doing absolutely nothing to help us and my people back home. And they continue to get sick daily. The health study we commissioned makes it clear cancer rates in our community are much higher than those in the rest of Alberta, and that's by 25%. If this continues, soon there will be no remaining Mikisew Cree First Nation members in northern Alberta. Likely within my lifetime. If the federal government does not act now and put a stop to Daniel Smith's plan to let industry release toxic tailings into the water system, then it is game over for us. There is no future for Mikisew Cree. We bought some of this very water with us, held up by one of my technical team here, Rachel. Take a good look at it. I want to ask all of you to ask yourselves, would you drink this? Would you let your children drink this and as well play? If the answer is no, then why should we or anyone in this country be forced to? At this time, I'd like to hand it over to Grand Chief Trevor Mercady.
Chief Tuckrow, thank you. And I'm speaking here on behalf of Treaty 8. Up in the territory of Treaty 8, specifically the Fort Chipewyan area, the Athabasca Delta, we're facing unprecedented issues there. Right now, the rates of cancer are skyrocketing, and they've been skyrocketing for the last 10, 15, 20 years. And it's important for us to band together, to come together as governments and find out what's really going on. The testing nowadays that's done is not effective in finding out what's really happening to the Athabasca Delta and other lakes and rivers in Alberta. And the reason this is a big problem is those waters are part of our culture, a part of who we are, and it's a part of who everybody is here in Canada. And if we don't start protecting the worst of what we have in Canada and in Alberta, it's only going to get worse for all Canadians. We have to make a stand in protecting this water. We have to understand what's going on with the water, because there is no understanding at this point in time. There's speculation. There's been tests done for 10s, 20 years, and we still have no solution. When do these studies end, and when does the solutions come? We have many previous chiefs, leaders, grandmothers, grandfathers, mothers, fathers, kids that are dying of cancer today at high rates in those areas. And for us to stand here and ignore the issue while we're talking about bringing the economy of Canada up, once again, it will be on the backs of our people. We will be feeling all the effects, and there's no amount of money that can fix that problem. When we talk about impact benefit agreements and all of these other ideas that the government would like us to be a part of, they will not work. Why? Because they will not protect our people. As we all know, money comes and goes. Funding comes and goes. But our people are forever. Treaty is forever. We are forever. It's not right that we're burying our families and our children, our grandparents earlier than other races of people just because of the location and the lack of inactivity when it comes to protecting our people from the environment that is not built by our people. Our people did not ask to be a part of this problem, but yet we're dealing with it. And then we have the governments and industry coming to our nations and our people asking us how to fix the problem. and then not listen. So we have a very serious problem here in Canada. And it's important that if projects are to be approved, that these problems are looked at and rectified. If they can't be rectified, bring in doctors so they can have the proper health care to find out what exactly is going on. Because something is going on. And our people are feeling the impacts. It's not going away. It's only going to get worse. And we will not be going away. Because no matter what happens, there's always somebody to take our place and fight for these issues. And that's what's going to continue to happen here until it's rectified. Our voices won't be shut down. Thank you.
At this time, I'd like to open it up for any questions that we have from the floor.
Hi, Leslie Pesifini with the Canadian Press. I'm happy I ran into you guys in the hallway. But in the Alberta MOU, there's no mention of water at all. Are you concerned about that, given the findings that are in this report here?
Yes, I'm very concerned, especially more so now with the federal government handing over that to the province of Alberta. We know for a fact in Alberta, they do not care about anything but the almighty dollar. So we are very concerned, especially with them trying to divert the water systems in our area. For far too long, they've used the water as a commodity when we use it as for our lifestyle and our existence. Thank you.
Also, if you're able to share some of the impacts that this has on your community, if there's any stories that you can share with us to kind of illustrate the problem.
Yes, I gladly. Since 1993 to 2022, we've had 149 cases of cancer, but we know for a fact that's grossly underestimated because a lot of our people, once they leave Fort Chip and they get the medical treatment or assistance out of community, those stats are no longer in community. That's why we're saying it's grossly underestimated. We figured for our people from Mikisew, we would say it's closer to 250 to 300 people. 6 out of 10 households have been affected by cancer in Fort Chip. Anywhere else, imagine this. The city of Edmonton, 1 million people, 600,000 people are sick, or of their 600 households. There would be alarms raised, but it's because of our color of our skin that they would choose wealth over our health. For too long, my people have been collateral damage. For too long, the almighty dollars ruled in Alberta over our people's lives. I don't even make it home anymore. I find out someone else is sick. Every time with cancer. I know for a fact there's people right now that are in a hospital that are going to pass. And their poor family has to sit there and watch them perish. There's people that are actually back home now that choose not even to leave community anymore. They'd rather be around their family instead of passing in a hospital. I know for a fact, we did it firsthand with my mother. They're rarest forms of cancer, bile duct cancer. And we know for a fact Alberta has been lying from the get-go. The bile duct cancer, they said the first one was 18 years ago. My best friend is dead. They gave him 18 days from the time he was diagnosed. I was in the hospital. You could see tumors growing on him. If this was a white person, this wouldn't be acceptable. And I know for a fact, one of my counselors, we know for a fact that his grandfather passed from bile duct cancer 21 years ago. So we've been lied to for far too long. For money. And we raise our voices right away. They want to pull our contracts. To shut us up. Anywhere else, you go for a small community with 1,000 people, you'd never have to take down a fence in a graveyard, Christian and Anglican. I'm 48 years old. The graveyard, there was only 2 rows since I've been around. That place is grown right into the middle. We've had to build another graveyard. 1,000 people. There's not even 1,000. There's probably 900 or 600 of us Mikisew people. And what's killing my people is the water quality standards that we've been coming here to lobby Mark Carney, Daniel Smith, industry to bring those water quality standards, because what's implemented now is what's killing my people. They will not put it in their machinery, these tailings that they wanted they want to treat and put it into the river system. 4.5 million in 2022 was put into the river system. And we found out 9 months later from Imperial. And I can say this, I've been the chief since then. There's been 50 to 60 additional cases of cancer, minimum. Anywhere else, everybody would bells would be alarming everywhere. But us, being First Nation, we are collateral damage. And Canada, the way that you guys go around, Danielle Smith, Carney, you guys go around parading safe environmental oil sands. Look at those stats, 149, that's grossly underestimated. Going to Saudi Arabia, going to all these different countries, talking about how safe it is. If it was safe, why are my people so scared to get checked up on? Because we know. Then you know why? Because by the time we find out, it's stage 3 or 4 cancer. Because why? We're remote. My people go to the hospital or the clinic in our town. We don't even have a hospital. We got a clinic. And we're directly downstream from oil sands. By the time my people go back, I know this, my mother, 10 times she went back to the clinic. Headaches. By the time it was stage 4, her cancer. And I know this is what's happening to my people right now, because that's why they choose not to be in the hospital. They come home, and who has to foot the bill for all this? We do. Our own source revenue, because the governments won't step up. But we do this because we love our people. The way Canada should be loving everyone. Doesn't matter the color of your skin. That's where I'm coming from on this. Canada, you guys need to wake up. Alberta, industry. Don't sip our mouths when we raise concern. If you guys value your relationship on the other side of the table, like you guys say when we sign these impact benefit agreements, it says clearly right there, impact benefit agreement. Impact, that's what you're paying. You're paying to kill us. And it's got to stop. And it's stopping now. And that's why we're saying about the toxic tailings, absolutely no go. They want to, on a small scale, on bad years, they want to put 10 million. That's only one. That's only one player. And there's 9. Times that's 90 million. That's a bad year, minimum. The years they want to produce more, they're going to double it. 20 million. And the rate we're going at, there's not going to be anybody left in Fort Chip. That's why we're seriously talking about relocation. Do we just stay there and die? Or is people going to step up and help us now? And these water guidelines, they have to change. If it's not good enough for your machinery industry, why is it good enough for us? Thank you.
Thank you.
For those who joined on Zoom, if you have a question, please use the raise hand function. Pour ceux qui se sont joints à la conférence sur Zoom, si vous avez une question, s'il vous plaît, utilisez la fonction main levée. Thank you. This concludes the press conference. Merci, c'est ce qui m'a fait à cette conférence de presse.
Thank you. Thank you very much for taking the time to be here today. It means a lot. And this will not be the last you hear from Mikisew on this issue. Thank you.
Share who you're meeting with today, if you're meeting with any of the ministers.
We could probably share that agenda. We got a full agenda from rest of the afternoon. We're meeting with Gull Masty in an hour's time here. We'll be meeting with Billy sometime. A bunch of ministers over a period of time here. Again, to lobby to bring these concerns forward and to implement these different healthcare that we know that's lacking in our community, so our people can have that adequate lifestyle that everyone deserves in Canada. And I can say this too, Carney, Danielle Smith, go ahead and do your tailings, but Ottawa, Calgary, you guys drink it first, because we're tired of being your guys' guinea pigs. We're tired of it. We're tired of it. You guys drink it first. Let your kids swim in it. Let your kids get sick. Let your animals, let your berries get sick. We can't even eat fish anymore. Moose, our studies clearly states that. The moose consumption has to be bought back. Thank you.
You're referencing, do you know where you can get a copy of that?
The thing is, with our report is up to date till last year's data, but I can say this: Alberta Health Services will not give us the data from 2022 to 2026 because the correlation of the Imperial incident of 4.5 million. And I can say this confidently: I became the chief in 2022 on October 8th, and before I became the chief, I started to see what was going on in the community. The guy that I took over from late Peter Powder, my chief, he passed the cancer. This issue is real. And then the chief before Peter, and the guy before him, it was the late Chief Steve Cutter. He also died from cancer. Am I next? But I'm gonna say this: at least our word is heard now. Canada, you guys have to do something now. I shouldn't have to come here to beg for my people to have a better lifestyle. Anywhere else, they have adequate services. Thank you.